If you have had a cardiovascular event recently, you may be coming to terms with many changes. You may be concerned about resuming sexual activity. Try not to worry. We created this educational tool to help with your peace of mind by addressing any questions or concerns you may have in this area. It's perfectly normal to be worried about being intimate after a cardiovascular event, and if you wish, you can talk to your healthcare provider about these concerns. Ideally, you should speak openly and honestly with your partner about sex. Frequently, patients' partners are also worried about how sex may affect your heart.
I was at home when I had my stroke. I felt very unwell. I couldn't speak properly. My arm was lifeless. My husband called our GP, who told me I was having a stroke.
I was loading the van to go to work when I got a real bad pain in my chest. My wife called an ambulance and the paramedic knew from the heart trace I was having a heart attack.
Our sex life was normal before the bypass, and then everything deteriorated.
I'm very frightened that she will have a heart attack during sex.
My name is Mary Rogan and I'm a GP with a special interest in sexual dysfunction. I have training in psychosexual therapy and in sexual medicine. Sexual problems impact on our quality of life, psychological well-being and relationship satisfaction. They are made worse by fear of speaking to your partner. Patients can also be embarrassed to talk to their GP or healthcare professional. So how does cardiovascular disease affect your ability to enjoy a normal sex life? And more importantly, how soon is it safe to resume having sex after a cardiovascular event? Sex is considered as another form of moderate exercise. It doesn't put a special kind of strain on your heart. It's generally considered safe to resume sexual intercourse when you can climb 2 flights of stairs or walk briskly for a short duration without feeling faint, dizzy, having chest tightness or shortness of breath. If you do experience any of those symptoms during sexual activity, it's important that you report those to your doctor. So you're going to try to reconnect by being intimate with your partner, but you are scared. What can you do? Avoid rushing into sex to prove things are back to normal. You or your partner may be a little anxious about sex. It's important to take your time and ease back into sexual activity. Take the pressure off and don't expect too much at first. Resume sex slowly and allow it to happen naturally. Sex starts in the brain. It's a journey. Stay connected to your partner. Continue to love and desire them. And tell them this. Stay in touch. Literally, hold hands, hug, kiss. Reassure her that she's still lovable, or him that he can still make you want him. That's a first and very vital step. Both partners should be willing and happy to engage in the process. You don't need an erection to have an orgasm. Sex doesn't have to be penetrative to be pleasurable. And if you can't currently have what you once loved, then love what you now have. It's common for patients to experience sexual difficulties after a cardiac event. There are solutions we can offer, so please talk to us about the issues. Many medicines may affect sex drive and sexual function. Those can include some blood pressure medications, tablets used after heart attack or cardiac surgery, water tablets, diuretics, sedatives and antidepressants, some medicines used for chest pain or irregular heartbeat. Some medicines make it difficult for men to get or maintain an erection. For some men, they may have premature ejaculation or no ejaculation at all. Women may not have enough lubrication, which can make intercourse painful and difficult. Some women may not be able to get sexually aroused, or they may be unable to have an orgasm. If you feel your new medications are affecting your love life, please don't stop taking your medication without checking or talking with your healthcare provider. It is understandable to feel shy or embarrassed to talk about this topic, but remember that your medical team are trained to discuss and advise with those common problems. Solving the problem may be as simple as changing the medication, but it's vital that you do this under your doctor's supervision. You may have sexual difficulty because of your heart attack or stroke. You may have been having difficulties anyway, as sexual function can diminish with age in both men and women. The important thing is that you stay connected, that you continue to communicate. Communication is very important. Talk to each other, and also if you have a difficulty that you think might be solvable by your doctor, go and talk to your doctor. Remember the caption, it's good to talk.
Hi, my name is Pauline Shields. I'm a clinical nurse specialist in sexual wellbeing in the National Rehabilitation Hospital in Dublin. It's common for men who have been diagnosed with cardiovascular disease to have erectile difficulties. Indeed, studies have shown that the rates of erectile dysfunction among men with cardiovascular disease are twice as high as those in the general population. Erectile dysfunction is recurrent inability to achieve a hard penis to complete sexual intercourse. Erectile dysfunction can be caused by a number of factors, and these factors often work in combination. Physical factors can result in a narrowing of the arteries and/or a lack of blood flow to the penis. As indicated earlier, medications can also play a role. Chronic stress produces changes in the body that make it difficult to achieve or maintain an erection. Unfortunately, worrying about this issue, including performance anxiety, can inadvertently make matters worse. Depression, so common after a cardiac event, can also affect your sexual drive. Many men find talking about such intimate matters very difficult, but your doctor is well used to dealing with these topics and will put you at ease. You could open a conversation with one of the following. I'm not able to have sex like I used to. Since I had my cardiac event, my normal sex life has been affected. I am worried that I may not be able to get an erection anymore. I would like to ask you about erectile difficulties. There are a number of treatment options available for men who are experiencing erectile dysfunction. Try not to outrule the benefit of counselling. Dealing with cardiovascular disease requires an adjustment to lifestyle and the way you think. Counselling can support this change, helping you to reduce any anxiety and stress that can increase the level of sexual dysfunction. Counselling can help you to learn how to relax in a sexual situation, which can enhance performance, even if you may still require another treatment option. There are oral medications available that will help to improve and maintain your erection. These medications will start to work when you engage in some sort of sexual arousal. These medications are contraindicated with GTN spray and cannot be used together. Do not buy medications online as they may be fake. Always ensure they are prescribed by a doctor who knows your medical history and other medications you are taking. If oral medications are not suitable or not effective, there are still alternative treatments, such as injection therapy or a urethral drug pellet called Muse. Both these treatments can be easily used with some education on how to administer. Alternatively, there are medically approved vacuum pumps that some people may prefer as it avoids the need to use medication. Any of these treatment options can be discussed with your healthcare provider.
If you have a problem that you think might need medical expertise, then by all means go and talk to your doctor. Not every doctor is comfortable with the topic, but if your own doctor is not comfortable with the topic, he or she will certainly refer you to one who is. There are many trained psychosexual therapists in Ireland who can also help. And there are clinics for people in 3 of the Irish hospitals for sexual dysfunctions, including the one I run in Galway.
There are a number of treatment options available for men who are experiencing erectile dysfunction. Do not buy medications online, they may be fake. Also ensure they are prescribed by a doctor who knows your medical history and the other medications you are taking. Do not take Viagra if you have taken GTN spray within 24 hours. Some lifestyle changes are worth considering. Heavy alcohol consumption and smoking play a significant role in erectile dysfunction. Stress plays a major role in problems with erections. Relaxation techniques have been shown to help with erectile dysfunction and premature ejaculation. For some, achieving an erection is easier in the morning, so try making love then. Erectile dysfunction is a man's condition, but a couple's concern. By discussing your problem with your partner, the pressure may be relieved and erectile function may improve.
Attending a cardiac rehabilitation programme is an important factor in your recovery. The components of those programmes, such as exercise, medication review, stress management and smoking cessation, are very likely to bring improvements in this area and also in your life in general. If you're unsure about your symptoms or if it's safe for you to have sex, then ask your doctor or cardiac rehabilitation team for advice. Remember, take your time. It's as important to experience the journey as the destination.